Hi everyone, Dr. Adrienne Castrovinci with Healthy Living Chiropractic, coming to you live on this Thursday. It is snowing again here in Minnesota, so hope everybody referred back to my previous lives about snow shoveling and make sure you do it safely. So today we are going to talk about a topic that I've seen actually quite a bit of in my office recently, and it's scoliosis. So last week we were talking about the feet and kind of how that helps the structure of the spine. Scoliosis is exactly that. A kind of a problem with the spine and how it's developed. It is actually a curvature in the spine, kind of an abnormal curvature. So your spine should have a couple of specific curves. So let me show you. I'm going to grab my little spine model here. From the side, your spine should have a curvature in your neck, a mid-back, and in your low back, right? So those are all kind of the normal curvatures that we're supposed to have. When you look at the spine from this direction, kind of straight on, it should be nice and straight. That's kind of what a normal spine looks like. When a spine has, or a patient has scoliosis, that's actually what's called an S-shaped curve. So there's a lateral or kind of a sideways curvature in the spine that kind of creates almost this S-shaped here. That is not normal. That is not okay. And that's kind of what we're going to be talking about today. So we're going to talk about kind of what is scoliosis. We're going to talk about the reasons, the things that patients can experience when they have it, the things that we can notice as practitioners or as parents, kind of what the medical profession would do about it, and kind of what chiropractors do about it, because we look at things a little bit differently. Okay, so like I mentioned, scoliosis is a curvature, an abnormal lateral curvature of your spine. It can be rated in different degrees. So the way that it's measured is you take an x-ray and you measure the top vertebrae and the bottom vertebrae, kind of where that curvature occur. And that angle that creates, that angle is measured. That's called the Cobb angle. And so you've got mild, moderate, and severe forms of scoliosis. So your mild scoliosis is 10 to 25 degrees in that Cobb angle. Moderate is 25 to 40 degrees. And then anything above 40 degrees is considered a severe curvature, or severe scoliosis. All kind of require different types of treatment. And they all can kind of, like I said, recommend different types of things to do as a result of them. The types of things that we're going to see with patients that have a scoliosis is generally, for the first part, not any pain. The patients or the people that are most affected by this that we're going to really be paying attention to today are young prepubescent girls. So girls kind of in that 10 to 13 age range, that's kind of the prime to find or to recognize a scoliosis. As the body or as the person, generally, like I said, generally girls, boys can get scoliosis as well too. It is more common in girls, but as they reach puberty and they have their growth spurts, oftentimes those curvatures will get worse. And so that's something we really want to address early on. So some of the signs that you could notice, again, as a parent, is looking at the shoulders. So shoulders that are uneven. So if one side's higher than the other, that can be a sign that there's a curvature, an issue in the spine. If the hips are unlevel, kind of if they're a little bit off balance, that could also be a sign. If you guys watched my live last week, we talked about what orthotics can do and how that can help with the alignment of the spine. That's what we focused on. If the feet turn in, then that can affect how the posture is. So these kind of tie in together if you're picking up on what I'm putting down here, guys. Also, if you look at the back of the spine, the shoulder blade, the scapula, that's what that is, kind of the shoulder blade. One side could be higher than the other. One could kind of push back and kind of jut back behind the other. They're not symmetrical. That's another sign that there could be a scoliosis. Another thing would be what's called a rib hump. So kind of where the ribs are in the back, you could see it being a little elevated or a little higher on one side or the other. When there's that rotation of the spine, it causes the spine as well as the rib cage to turn. So picture this as your rib cage. If you've got a curvature in your spine, you've also got rotation, and it's going to cause that rib and those ribs to kind of jut forward or backward on the spine. You could also recognize, if you see the collarbone here, sometimes it can push forward on somebody that's got a rotation or a scoliosis, indicating some postural issues as well too. So really what we're looking for is imbalances. If you see these with your child or a family member or someone that you know, it'd be a great opportunity to get an evaluation or to look further into that. A lot of our patients, our wellness patients especially, we do gown them once a year. We do re-exams. exams, and we do spinal scans. And so we'll have them put a gown on, so we open up and we look at their back, and we make sure that we look at the posture, and if we see any of these signs, then we're doing an evaluation for scoliosis. There is a test, it's called Adam's test, and many of you guys may remember this from grade school when you were a kid. You stand, you put your hands kind of like in this upside down prayer position and lean down. If you do that, you can lean down, and if you see the rib kind of hump up on one side, that's a positive Adam's test, and that is also another sign for scoliosis. So if you see that, or if you're concerned about that, see that with your child, again, a great evaluation would be warranted. Okay, so those are kind of what types of things that you can see with a scoliosis. Like I said, a lot of times with young children and even teens, there's not going to be pain. They're not going to have pain in the upper back. They're going to have tightness. They may feel really tight up there, but there's not going to generally be pain. Generally with older adults that have scoliosis, they will most often have more of a pain component, but generally not with children or early teens. So that's a big thing, is that they're not complaining of pain doesn't mean there's not a problem. So let's look at kind of what it is we can do about that. So in the medical world, if you or your child has a scoliosis, say they've got a 13-degree curvature, they're going to say, you know what, it's no big deal, just wait. You know, there's nothing we can really do. We're just going to wait and keep an eye on it. And like I mentioned before, as the child grows and as they go through more growth spurts, it's going to get worse. It's not going to just up and get better on its own. If there is a curvature, it's only going to be more pronounced, and we'll talk about kind of why that is here in a minute. So they're a wait and see. If it's 20 or 30 degrees, then they may put the patient in a brace, like a Boston brace, which can then kind of help to stop. The main goal at that point isn't to fix anything. It's to stop and halt the progression. So it's not going to get worse, or they say it's not going to get worse. Sometimes it does, but it's not designed to get it better. And then kind of the third and the most invasive is if they get into that severe category over 40 degrees, then they would do a Harrington rods type of surgery, where essentially they're fusing the child from the middle back, from the top of the scoliosis to the bottom of the scoliosis, literally fusing the spine. And that is no bueno. I have a few patients that have experienced that. I have a few friends that have gone through that. If we can try to avoid that, that's going to be my main goal as a practitioner. So let's look in the chiropractic side. So if I have a patient, like I said, I've had 3 patients that come to mind in the last 6 months that have come in that have all had mild curvatures. What we're going to start doing is we're going to adjust them. We're going to make sure that we find those areas of their spine that aren't moving well, that are rotated, and start to kind of rotate them and shift them the other direction. But the big thing we do here in chiropractic, and as well as in the nutrition work that I do, is we look for the cause, okay? Generally, scoliosis is a diagnosis of idiopathic scoliosis. What that means is we don't know the cause. What a lot of times though, what I see the cause can be is an abnormal pelvis. So kind of like I mentioned with pelvic unleveling, if the hips are off balance, then that's kind of what can help diagnose a scoliosis. But if you think about it, the base, and we kind of talked about this last week, if the base is here, the base is a little tilted, and you've got a spine that's growing, it's going to kind of follow the path of the curvature. And our eyes need to be level. That's what equilibrium means, is your eyes need to stay level. So if your base and your pelvis is tilted and your body's growing and the spine is growing, it's going to correct itself and it's going to adapt so that the eyes can be level. So your body's then going to create that curvature to create that straight spot, neutral or straight horizon for your eyes. It's kind of what nature does. Nature wants to balance itself out. If things are off down below, it's going to fix it itself. It's going to adapt it, it's not going to fix it. That's where we come in. So if I see a child that has an uneven pelvis, an uneven tailbone, that's the base where that spine is sitting on, I'm going to adjust that spine. I'm going to balance those hips out. I'm going to fix that leg and make sure that we can level it out. We're going to work on the feet. We're going to get them orthotics. We're going to do some strengthening exercises to strengthen the weak side and to relax the tight side. We're going to work on massage. We're going to work on some PT, those kinds of things to help to support the spine so that it grows more in a correct position versus that curved position. So we're going to take a very active approach, a preventative approach. I've had a number of kids that they've come in, we've taken x-rays, we've done They've had curvatures of 13, 14, 15 degrees. We've been able to get them back to 0, which is awesome. So my whole point with this today is educating you on what is scoliosis. Who is most at risk is going to be your young prepubescent girls, kind of in that 10 to age 13 range. If you have a child in that age range, I would love to have the opportunity to check them and just make sure everything's lining up appropriately. If it's not, then we can do some things to help handle that. So wanted to make you aware of it, let you guys know that I can be a resource for any of these